Hello everybody, I'm Teun Teunis, a plastic surgeon at UPMC in Pittsburgh. Today I'm discussing an impressive database study on flexor tendon repairs. Now, no matter what side of the aisle you're on when it comes to wide awake hand surgery, if you do flexor tendon repairs, you're going to like this study. Some proponents of wide awake surgery with local anesthesia only feel that they are better able to gauge tendon gliding and repair gapping at the end of the case, because the patient is awake and can move their hand at the end of the repair. It makes intuitive sense that if that is the case, there would be less tendon ruptures or adhesions after the tendon repair. To put this to the test, the authors queried the Pearl Diver database, a national claim database, to look for people having Zone 2 flexor tendon repairs with or without digital nerve repair. They divided this cohort into people having flexor tendon repairs while they were awake with local anesthesia only, and compared that to people having a block, sedation, or general anesthesia. After matching these two groups based on demographics such as age, gender, and comorbidities, they compared the rate of reoperation for rupture or stiffness the year following the tendon repair. The matched cohort included over 2,500 people, which is a substantial amount. And the authors found no difference in the 30-day wound complication rate or the 1-year reoperation rate. Now, what to make of this? Well, if you're not really into wide awake hand surgery, for whatever reason, you can rest assured that outcomes seem equivalent. On the other hand, if you're a proponent of wide awake local only surgery, you can conclude that this approach is safe, and the authors did find somewhat lower cost associated with wide awake surgery. Like I said, whatever camp you're in, I told you you were going to like this study.